um, just say that we will be covering a few different perspectives today. And what makes, I think, today's virtual panel really exciting is that we have a fund perspective, we have a founder perspective, we have a legal, obviously, and all sharing legal backgrounds. And then we have sort of a more traditional healthcare transactional perspective. So, with that, I am going to turn it over to the panelists here to introduce themselves. And then, after a quick introduction and overview of what we're going to be talking about, we'll get kicked off. So Kaushik, do you want to kick us off?
Yeah, absolutely. First, it's a pleasure to talk with you all today. Really, really excited about this. I'm Kaushik Srinivasan. I'm the managing partner of Cerulean Health. We're an emerging medical fund this year, focused on predominantly biotech and medtech. I'm a former hospital executive and a former operator in the healthcare space.
Neil, do you want to take it from there?
You're on mute, Neil.
Okay, great. There wasn't letting me unmute for there for a second. So, hi everyone. Thank you for jumping on. Very interested in this conversation. So, my name is Neil Shaw. I'm a shareholder with Pulcinelli based in the Chicago office. I am a healthcare attorney, primarily focused on provider representation. So, hospitals, health systems, and entities that work with them, physician practices, things of that nature. Very interesting times in healthcare right now. A lot of changes on the regulatory side as well as just in the business of providing care. So looking forward to this conversation.
Kifa, we're up.
Hi, my name is Akifa Katak. I'm a healthcare attorney. I have a background in biotechnology and health administration as well from Cornell and Hopkins, and I am the founder of Heal Her AI, which is an endometriosis diagnostic company, and also Codiva as well. I am also a past Miss Universe contestant, and I started all of this because of my own case of endometriosis, because there was a lack of diagnostics. So I went from being an attorney in a firm to now being a founder. I also do some lobbying as well in DC.
Great. Thank you all. I'm a privacy and technology attorney. I've spent time at AmLaw 100 Farms. I've spent time as chief privacy officer, started out very briefly in the government. And currently I serve as executive legal advisor to an AI biotech company, as well as I help lead AI governance efforts at a publicly traded healthcare financial services company. I'm also the SABA Health Law co-chair. For those of you who've come before, you've heard me probably say we are working hard to get this section revived. So this is one of more events this year that we will be working to get to you. So stay tuned for that. With that, I'm going to get right into the discussion. So after we hear, we're going to hear a little bit about market dynamics. We're going to hear a little bit more about Akifa's journey as a founder. Again, really great, unique perspective. I'm really excited to have those perspectives and hear from them. And then we're just going to talk about some cross-cutting considerations for this topic. So I think you'll hear a little bit more on the government focus from Neil. You'll hear about reimbursement and payment innovation, capital and deal structure, data privacy, AI governance kind of considerations. And then we'll have time for questions at the end. So if you have any, feel free to put them in the chat and some time for takeaways. So with that, Kaushik, I'm going to turn it back over to you to get us started on market dynamics.
Sorry, just to kick things off a little bit here. So, for those of you who aren't in the healthcare industry or haven't spent a considerable amount of time here, the biggest thing to keep in mind before I go into all this detail is that what we consider healthcare and life sciences isn't really a singular sector. It's really more a hodgepodge of about 5 or 6 different sectors, all of whom have completely different dynamics and completely different market forces. Because traditionally, what we think of with what clinical services, hospitals, clinics, physician practices, things like that. A lot of what Neil does with his work as as a transactional attorney in the space. However, the space is extremely broad because you have biotech companies, the therapeutics and diagnostic space. You have medtech companies with medical devices. You have a substantial growth in the digital health space. So that's the one thing to keep in mind here is that this is to lump this all together as a singular industry is not entirely fair to the perspectives that you're going to have on it and the trends that have been occurring in each of those sectors. I mean, even just taking the clinical services piece, and I know Neil's going to have a lot more to say on this part. If you look at how hospital and clinic markets have been trending in the course of the last several years, especially even post-COVID, we've seen the last 10 to 15 years that there have been dramatic M&A activity, considerable consolidation between various hospital systems across the U.S. and even globally, with U.S. health systems wanting to expand into various markets, notably the Middle East and Asian markets. But that hasn't necessarily been true across all the other sectors. While we've seen that consolidation for a variety of factors, including the rising cost of healthcare, rising cost of internal operations, increased regulatory and administrative burdens, some of which we're all going to talk about a little bit later on in this call. We've seen in some ways opposite forces in the other sectors. So I personally, as an investor, spent quite a bit of time in therapeutics, diagnostics, and medical devices. And we see similar trends in those spaces that are very different than what we see in the hospital and clinic worlds. For instance, we've seen a fairly significant dearth in investment activity in those three sectors in the last few years in particular. We know that in this exact same way that we've had a lot of M&A activity and a lot of consolidation, a lot of dollars being thrown at hospital and clinic consolidation, we have seen multiple investment funds, both venture capital and private equity, even get out of the healthcare space altogether. I've had a number of colleagues in New York, as well as San Francisco and Boston, who, if we don't have dedicated funds specifically for biotech and medtech ventures, they're not really interested in the medtech space anymore because of a variety of factors, including high regulatory burdens. We're going to talk about that a little bit further. Large capital expenditures compared to other industries that we investors could invest in, very long lead time and investment horizons before we can get to exits. And so you're starting to see a number of therapeutics and diagnostic companies in particular really start to die on the vine in the last 4 to 5 years, not because they're not able to be successful, but because they're not able to get the funding to continue, and investors aren't really interested in pursuing the space as much. Some of that has mitigated tremendously in the last year to year and a half, and I know Akifa could speak to that a lot more than I can. But that's been the general trends that we've seen in many of these spaces. And there's a lot more I can go into, but a lot of that's going to cover what we're going to touch on these various topics. So Amy, I'll kind of throw it back to you for the next piece.
Hey, thanks for that context as we turn to Akifa to hear more about both the issues that you think about and you come across and your journey as a founder.
Sure. So, a little background about my company and then everything I have to think about. It's completely different. Well, yeah, actually, it is completely different priorities, I would say, than working in a firm as a client and you have a concentrated view of what your client wants, right? So that is the expertise, the deep dive that they cannot, comprehend all the different things that come about with all of that. Whereas as a founder, it's really important that healthcare attorneys understand their client's mentality and understand what's driving them, why they're making the decisions. Though you have to know all of the different holes that they might not foresee. And in terms of Heal Her AI, we are an endometriosis diagnostic company. So I'm not so sure if anyone is familiar with that disease. It's a women's health disease. 1 out of 10 women have it, 200 million worldwide. It's the top 10 most painful diseases, leading cause of infertility, and you get diagnosed after 10 years through a surgery. And we're doing it non-invasively through machine learning. So from 10 years to a few seconds, and that's what we're trying to put into the hospital systems. And so obviously it comes with a lot of things to actually get into a hospital. And so understanding all of that would be very helpful for an attorney and their client. So in terms of the different topics, I'm just going to list all of them and we're going to try to hit them very lightly and then we'll do a deeper dive. I think the other attorneys will focus more on them. So number 1 is business models. Number 2 is financial strategies. Number 3 is the actual solution, so the R&D. Number 4 is IP protection. 5, regulatory, compliance, data privacy. Just lumped it all, but it's definitely not all the same. Clinical trials and FDA. Then your go-to market strategy, your interoperability, and then finally reimbursement. So in terms of the very beginning and business models and finances, you want to understand the mindset. So what is their actual solution that they're bringing to the market? You want to understand the regulatory, the privacy, and everything I just mentioned. I'm going to read off some of my notes here. So in terms of the business model and financial planning, they're different kind of pricing based on how they're going to have their product. And I'm talking more about med tech actually in general. I'm going to be a little more focused on that. But there's B2B and B2C. Are they direct to consumer or is it business to business? And then is there consumption-based pricing? Is it per transaction, per user, per site? Are there premium entry points leading to subscriptions? How exactly are they going to price their product, right? And that matters because when you're developing it, there's a lot of technical costs that come into play with AWS when they're building it. So the engineers have to be aware, and the CEO has to be aware of how they're going to market it as they're building it. Otherwise, they're going to have to redo that. You also have to think about different things as a founder. So your projected and cost analysis. There are different decks that you have to do, burn rates. I'm not sure if you guys are familiar with the TAM, SAM, SOMs that always change, but essentially it's your market and you want to pretty much present these to investors. And we can go a little bit more into that, but there's all of that. And then also there are different hybrid models as well in terms of payer and provider needs. So that's really important when you're also dealing with reimbursement and the actual physicians. In regards to funding, just the bare basics, there's different kinds. First and foremost, there's non-dilutive, so bootstrapping, grants, crowdfunding, and there's dilutive, which is angels, VCs, and different programs. So you could have an accelerator or an incubator, you can have pitch competitions, and all of those different things are ways for a founder to kind of get their feet wet and be able to get some funding behind it. And I'm sure the other attorneys can probably speak on this a little more, but you have to also be careful when you want to deal with VCs and if at all, quite frankly, because a lot of founders have been burned quite a number of times in terms of their IP, in terms of, obligations, expectations, certain mergers that they were not aware of, all these different things. So just in regards to VCs, for me, I always say like the later the better, but each to their own. But those are things you guys should be aware of in terms of the clients, understanding the client. Other things is at the very beginning, they're going to have a lot of pitches. So things that they need are NDAs, NCAs, if they have any proprietary information. For some reason, there's so many amazing CEOs and they're so ready to capture the market and all these different things, and you ask them about their IP protection and they don't really understand it, or they think about it way too late, and it's really a disservice for the whole company. So as early as you can, tell them, hey, make a provisional filing with the USPTO if you have a patent or trademarks or copyrights from the get-go. Have some of those things. I mean, I know some companies that have made a lot of money through software licensing agreements, but they don't have a single patent. They don't have any other kind of protection. And it's a little surprising, from that. So having all of those things would be very important, and understanding there's two different pitch decks. There's investor pitch decks and then there's customer ones. There's also these data rooms that they have to be aware if they have any employees and things like that, that they sign off to make sure their data rooms are protected and they have the proper legal documents. And so that way, if there is an investor that comes in and they want to do their due diligence, that data room is cleaned up, essentially. In regards to the commercialization and the go-to-market strategy. You have to make sure that there's a product market fit. Man, I don't know how much time I just ran.
Got a couple minutes. I'll jump in and feel free to keep
Okay.
talking. I'll jump in.
Okay. So you want to understand, obviously, your product market fit, and then whether or not there's, I think I'm just going to do rogue because honestly, this might not be enough time to go through all of these little details. But let's see. We talked about their actual R&D and then IP protection. So like I said, they can at least go and do a provisional application, if not a non-provisional whenever they're ready. So earlier to the USPTO, better because the earlier filing date always wins. And so that's one thing that's really important. Also, the ownership of that IP and how it's going to be distributed as well in a software licensing agreement is very important, separate thing, but important as well. In terms of regulatory, there is, okay, great, I made the software. Now what? Can we just go and market it, or do we have to go through FDA or whatever have you for this clinical trials? So they're different things. How you're going to what your inputs are matter. So can I go through the breakthrough pathway? Can I make it a clinical decision support? If I do that, I might even get to bypass FDA entirely, or is it going to be a class 2 de novo? Are we going to do a 510K in order to get through FDA? How exactly are we going to do that? And then obviously when you're going through FDA, you have to understand that, okay, there's all these sites, you need to have the informed consents and all of that. And something important founders don't know is that the data that you use to train the model can't be the same data that you use for FDA. So they need to have a big pool or access to a pool that they can do that. In regards to go-to-market strategies, again, so now we have the solution. We are figuring out whether or not we can go into the market or not. And if you can go into the market, the next step is, who are you trying to sell it to? So a hospital, for example, they're going to be like, oh, that's great and dandy, but do you even have interoperability to where we work with the EHRs? Can it work with Epic? Can it work with all these different things seamlessly? So that has to be accounted for. Also, your HIPAA audits as well. You have to make sure everything is in compliance with all of that. And then only they might consider you. And then they'll go, okay, well, we like what we got going on now. How is it going to profit essentially? So you have to think about the economic based data that you can get to say, hey, this is how much you're going to save. This is how much it's going to bring to your hospital. And this is why you should use it. And typically you have a a physician champion to kind of speak on their behalf and say, hey, we need this tech in the hospital, and you do pilot programs. And then with that, you have to think about the pricing. So are you going to go through reimbursement, or are you going to, have some other kind of pricing model? And reimbursement is a whole nother thing. If there's no
Thank you.
codes, okay, sorry. So that's pretty much,
No,
we'll go, we can talk about it if anybody has questions on those specific topics in detail, but you have to think about all those different things essentially as a founder, which is quite a bit, as you can tell.
no, I didn't even mean to cut you off. I was going to say that's such a perfect segue into talking more about reimbursement and payment innovation. So thank you so much for setting that up and for all the overview and the context. I think it's been great as we move on to these topics. So with that, actually, Neil, I'm going to kick it over to you. Do you want to tell us more about payment reimbursement and payment innovation? Particularly, what's happening from what might be happening from a government perspective.
Sure, absolutely. And yeah, Kifa, thanks for setting me up like that. I first just want to say it's very beneficial, I think, for this conversation to actually have a founder involved. I mean, I think that getting the perspective of someone who's trying to navigate everything I'm about to cover, is extremely challenging. So I think I want to I'm glad we were able to tee it up that way. There's a lot going on the governmental side right now. There's often a lot going on in government regulation of healthcare. It's about 20% of the overall the country's GDP. It's always highly regulated. It's always an area of focus. But in the last year or so, it has been an area of very particular scrutiny and change, which is interesting. It creates opportunities, I think, for investment, but it also creates some substantial risks as well. Um, when we talk about government issues in healthcare, that's an extremely broad topic. To Kaushik's point, we can talk about all sorts of different sectors. I want to highlight a couple of the ones that I've been seeing that have been particularly important for our clients and have been material in thinking about investment decisions in particular. Um, First, reimbursement. That is often the biggest question in healthcare. How do we get paid? What's our revenue model, right? Reimbursement is changing very substantially right now. Some of the trends we're seeing is on the government side, we're seeing both reductions in many lines of governmental business. So Medicaid, Medicaid managed care, Medicare Advantage, the exchanges. We're seeing policy changes that in many cases are driving reductions in enrollment or making them less attractive for beneficiaries and patients. Also, reduction in the scope of coverage in some cases as well, which if you're a provider that's heavily dependent on those areas, can create challenges. Also opportunities though, because there is now more support needed to kind of help that population. On the Medicare side and in some of the other areas of the coverage population, we're seeing a lot of interest in demonstration projects. There's been a slew of new payment changes, especially advanced by the Center for Medicare and Medicaid Innovation. Things like specialty focused bundle payment models, new kinds of accountable care organization models, essentially new revenue sources, particularly for the Medicare population that move away from fee for service. They also move away from the more historic kinds of ACO models. So things that promise advance payment of capitated payments, more focus on high need populations, more specific support for lifestyle interventions, things of that nature as well. These projects are interesting. They create new opportunities. They're also highly complex. That also opens up a bit of a lane for entities and businesses in this space because it takes work to understand how they work. Number one, understand your reporting obligations and understand how to be successful given an entirely new rule set for, in some cases, a large chunk of your Medicare reimbursement. Lastly, on the commercial side, including the employer side, there's just a lot of tumult in that sector. There's ongoing issues on the provider side with getting paid and getting reimbursement. On the payer side, they I think would point to concerns around increasing cost and utilization. There's all sorts of room for disputes, and we're seeing kind of those disputes getting more intense, I think, in the payer versus provider world. That's driven in part by, payer policies and provider working within those policies. So things like prior authorization, denial policies, disputes around how long it should take to get paid. All of those things they've been background noise, I think, in the commercial reimbursement space for a long time. They're becoming very acute. They're becoming issues that are kind of driving a lot of disputes that go from informal resolution to we're increasingly seeing more formal kinds of dispute resolution, including all the way up to litigation, contract terminations, things of that nature. That can be hard for providers who are in that world. So for example, if you're part of a health system that's decided to go out of network, that can be extremely disruptive. It can also be extremely disruptive for patients, who suddenly see their providers not covered by their payers. We're also seeing increasing amount of friction around documentations. Documentation is extremely important in the healthcare delivery space. Ultimately, a lot of payment is driven by what you document, what you collect in terms of data. As you might expect in any kind of data gathering and documentation world right now, that's all being thrown into new forms of disruption because of AI. And so on the payer side, we're seeing much more sophisticated AI-driven claims management functions, whether that's denials, changes in coding, appeals, things of that nature. On the provider side, you're also seeing kind of almost a war of AI-driven documentation tools around making sure you're documenting everything necessary in the patient record, making sure that you're pushing back on payer denials or delays, making sure that you're taking advantage of all of your rights under your contracts and under the law. That's creating kind of an escalating dynamic in which both payers and providers are much more incentivized to kind of um, pick fights effectively, right? Not to be too colloquial about it, but essentially not let things lie to some degree. I mean, and actually push their disputes in some cases so that they're able to fully execute their contracts and the intent there. At the same time, I'm being hard on the payers, but costs are increasing. I mean, substantially. Utilization is increasing for a variety of issues and a variety of reasons. Some of that is provider prices going up, but some of it is that care just costs more than it used to. That's due to inflation, that's due to workforce shortages, it's due to technological innovation, things like GLP-1s and other kinds of really incredible innovations in the pharmaceutical space, things that really change the overall health status of patients, but are expensive. And so, that creates this kind of ongoing battle between payers and providers, patients often kind of caught in the middle. All of that has kind of reached a boiling point, I think, in this early stage of 2026. The second big theme I would call out is fraud and abuse and compliance. Regulatory scrutiny as a whole has just become much more of an issue, especially in the last 6 months or so. This administration has really highlighted concerns about fraud and abuse, and in particular, some pretty high profile cases of cracking down on fraud and abuse. It has also rolled out a variety of tools, everything from increasing whistleblower opportunities, more of a focus on fraud and abuse compliance and on internal compliance programs, changes in reimbursement and limitations on enrolling in federal programs for certain classes of providers. And so for investors in this space, the risk profile for particularly certain provider types and types of businesses within healthcare has just increased. And so that means more compliance spend. It means more need to be on top of and understand your exposure from a compliance perspective. And it can also mean suddenly having to look back at your revenue model and changing things up. A good example of that is a massive change in the way skin substitutes have been reimbursed, going from payment based on the price of the drug or the device in that case to much more of a fixed fee for service type payment that totally revolutionized the industry and significantly changed the economics of many businesses in that industry. That was driven by supposedly a concern around fraud and abuse, but it is ultimately a revenue change, and it ultimately changes the viability of many businesses in that space. The last thing I want to call out is, and Kaushik mentioned this a little bit as well, consolidation. Consolidation is a hot topic in healthcare right now. It's been a growing issue for several years, but especially in the last little bit here, we're just seeing much more of a dedicated focus, both number one on acknowledging that consolidation is a risk and a concern. That can be both consolidation vertically, so things like payers, hospitals, physician practices, other kinds of ancillary providers being absorbed into these sort of longitudinal organizations that kind of hit multiple types of healthcare provider. It can also mean horizontal consolidation of many different types of the same provider getting rolled into one platform. We're seeing both of those increase for many reasons. Some of those are very pro-competitive, better care for patients, more efficient care, lower cost care. I think all of those things are positives. They're the things that the consolidators kind of point at and say, this is the benefit to the system and are all coming together. But there are negatives as well. One of the concerns from a business perspective is just that larger organizations have more ability and have better ability to negotiate better deals. That can mean with vendors, that can mean with your counterparties, so payers versus providers, providers versus payers. It can mean with essentially every level of the healthcare business landscape. A larger organization generally has more ability to negotiate, but there are downsides as well in terms of increasing potentially prices and the patient kind of being left in the middle in that equation. So with that being a focus, we're starting to see regulatory scrutiny applied in that area as well. A whole bunch of different approaches. That again, all increases your regulatory overhead. But just to call out a few examples, we're seeing an increasing amount of regulation, particularly around investors in healthcare, particularly non-healthcare investors. So private equity being one of the big examples here. State regulation of PE-backed, especially healthcare transactions, has just increased, has continued to increase. That can be everything from just actual limitations on the ability to set up MSO type models, management service organization type models, which are favored by PE investors. It can mean state oversight of healthcare transactions, so things that require filing and approval by state regulatory authorities. And in some cases, it can just mean a limitation on outside investment in whole sectors. So particularly hospitals, we're seeing a lot of state level limitation and objection to outside investment in hospitals. That has a double-edged sword, right? I mean, it means you don't get access to capital on that business, but it's coming from a space of concern and potentially suspicion around corporate investment in various elements of the healthcare delivery landscape. On the federal side, we're also seeing an increased focus on antitrust and competition-based regulation, and I think we can get into that in a little bit more detail later in the presentation. But the point there is ultimately healthcare is a focus, and it is an ongoing focus of various different parts of our regulatory landscape, state and federal, multiple agencies, Department of Justice versus regulatory agencies. There's a lot of change in all of those sectors kind of focused on the healthcare industry. And it means that kind of your compliance infrastructure is kind of being tested in a way that in some cases it hasn't been, particularly for some industries, it hasn't been for several years. And so this kind of governmental focus is kind of becoming a key business consideration as well.
Thanks so much. And I think you already started talking about some of the MSO PC structure. So Kaushik, I don't know if I'm going to kick it over to you for a second and see, as a segue, what would you say on what's happening with capital and deal structures from what you see?
Yeah, and so I'll try to segment this into two pieces, because as I'm sure you've all been seeing now as we've been talking, we could go on for 2 hours on any one of these individual topics. There's just a lot of ground to cover in these areas. So as far as deal structures are concerned, I'll tackle Neil's world first with hospital transactions and physician practice transactions. Those tend to take on a very different form than what you see in, say, biotech or medtech sectors. In those sectors, it tends to be much later stage. So you're seeing the traditional private, what Neil was talking about with traditional private equity and how the investors in the space are getting to be increasingly regulated. Those deals tend to be your traditional M&A deals. So we're talking deals of 9-figure, 10-figure size deals that are going to be equity investments. Oftentimes, some type of priced round that's going to be a wholesale acquisition or a majority acquisition of some type of medical practice or hospital system. Those tend to be, there's a lot of regulatory challenges and a lot of questions around how those are structured. It's the critical points on those types of deals are less so about the actual deal terms itself in terms of the pricing information. It's more so about all the other things that go into it, like a lot of things that Neil talked about in terms of how are the MSO, like how do the MSO arrangements get into place? What are the actual arrangements with Medicare and CMS, and how do you transfer those accordingly between the acquirer and the acquiree? How do you handle the equipment and the resources that are being transferred between the entities? Those often tend to be the greater considerations, especially on the deals that I've been involved with between health systems, more so than the actual, is it an equity or VC stage transaction or anything like that. In the biotech and medtech sectors, I would say, especially for looking at these four in particular: therapeutics, diagnostics, medical devices, and digital health. You tend to see a lot of similar types of deal structures in those sectors or those industries, which is it's a very traditional venture capital or private equity market. Now, like Akifa mentioned, a lot of that market is now trying to get later and later stage because both founders and investors are wanting to come in at a later date now. Investors want to de-risk. Founders want to not give us as much control and not have to deal with an investment environment that's frankly very investor friendly right now. But those tend to be much more traditional VC style deals. So you're looking, starting off at the very early stage at a concept stage or maybe pre-seed or seed stage, you're looking at the traditional safe or convertible note type arrangements. Check sizes that are looking at $2 million or less in terms of the total rounds, as well as the individual check sizes from investors. These are going to be traditional startups in that space. Much like companies like Akifa's, are probably not going to do more than one or two raises in that space, depending on what their long-term regulatory hurdles are, if they have to go through FDA or CMS for their technology or their service. That tends to be much more of the focus and much more the typical bread and butter deal that we see at that point. And we're actually going through a few of those right now on our side where safes have become pretty popular in this day and age now. For those who don't want to deal with price rounds, they just want the simplicity of doing that deal flow, especially in digital health and in the tech worlds. That's a very common instrument and a very popular instrument. When you start getting into the later stage rounds, more traditional venture capital, so check sizes of 3 to 5 million or more, that tends to be something where you see at that stage and that size, you're seeing more traditional VC stage opportunities. So you're seeing price rounds, investment rounds that are between, say, $5 to $20 million. Again, varies on the sector, but let's say if we're talking a digital health company or a device company, you're probably seeing investments rounds of those sizes. Therapeutics will balloon very quickly. I mean, we can see a Series A round for a drug company, be as large as $300 million, depending on what the indication is or what the technology platform is. But those tend to be your bread and butter VC rounds. You'll have venture capital firms coming in as institutional investors, maybe some family offices as well, and they're going to structure things as bread and butter equity investments, usually minority deals, but obviously it depends on the specific transaction. That's at a very, very basic high level. That's kind of the lay of the land in terms of how things have been for the last 10 years. And even looking forward with this year and beyond, I don't really see much of that environment changing in terms of the types of deal structures that are offered based on the size or stage of the company in that sector.
Great. Well, so we're gonna, with the time we have left, we're gonna try to get started on data privacy and AI governance, and then maybe what we'll segue into the takeaways. I have a question for everyone related to this last topic. If you have a question, I'm going to take a minute and say, if you have any questions, please feel free to put them into the chat right now, and we'll see if we can at least get one or two before we end. So with that, Akifa, do you have anything that you'd want to start off on in this data privacy and AI governance topic?
Yeah, I guess related to the AI governance, I think that there's two things that are pretty interesting. First and foremost, I don't know how much everybody is familiar with what's happening currently in the industry with like agentic AI. And so that's just something to note is that I think right now the government is doing a decent job at rolling out really fast regulatory guidelines to kind of keep up with the ever-changing landscape. However, the private sector is just booming almost too fast. And quite frankly, as an attorney, I think there's a huge gap that more healthcare, so this is more of a comment than anything, but more healthcare attorneys should be involved with this regulatory framework, because you would be shocked. Like when I have to deal with, I went to the HHS conference recently, spoke to those guys. I do lobbying again with the White House, and the lobbying groups, they do great work, but a majority of these people are literally like advocates, and they are from, different backgrounds, which is fantastic. We want that, but we need lawyers to also be a part of it, because we get the back end of when there's all these holes. So shouldn't we be in the front end of the policy making to kind of avoid that? I mean, depends. I don't know how much our caseload will change, but in regards to this, it would help if attorneys are involved. And so that's just, I would encourage all healthcare attorneys to just kind of like put a forefront in DC, because they need the assistance for these kind of guidelines. The second thing is that with agentic AI, there is a lot of changes. So rather than shifting from generative, right now, you'll find engineers literally coding out essentially all these agents that will do things autonomously, right, on the business's behalf, which is fantastic. But then there's all these legal gap holes and data privacy concerns if you're going to allow that, and how it's structured when you have people that are making these assistants that don't have that legal knowledge of what would be the repercussion by having this done. So that's a huge thing. The other thing is in terms of tokenization. That's Sam Altman. He pretty much came out and said, we're trying to tokenize intelligence essentially. And the more money you have, the more access you have to these tokens. And if you don't have access to certain tokens, it affects the quality of the AI that gets outputted. So for example, why does that matter to attorneys? Because for example, if they are incomplete filings for, let's say, whatever they decide to draft up, but for litigation, it would be important for litigation review, any kind of discovery, for regulatory filings, for insurance disputes, essentially. So that's something that we always want to keep in mind with tokenization and how that's changing everything. It's almost like a pay-to-play situation. And then the other huge, huge thing that affects me all the time, and I think, oh, it's great, but also as a founder, but as an attorney, I worry about all of the legalities, is CMS just rolled out something called the access model. I don't know how many people are familiar. Neil, you're probably familiar because it falls in line with reimbursement, but the access model is advancing chronic care with effective, scalable solutions. And essentially what they're doing is that they are allowing certain tech companies to get paid with reimbursement if they can provide a certain health outcome, but it has to be a significant health outcome. And they allowed 150 companies to do this, which is like Noom, Headspace, Whoop, Doctronic, all of them for specifically a chronic condition right now. But essentially how it works is CMS will pay for participating tech companies a fixed annual amount per Medicare beneficiary, depending on the condition category. And so that's a huge, huge shift in the clinical improvement and payment models, right? And you also have to, I'm sorry, I'm home. I don't know if you heard the noise, um, but essentially, what's going to happen with doctors, right? Are we inputting our information to these tech platforms? And then is that how this is going to work? And then you have the larger players, which is, for example, Google, Claude, ChatGPT, that are saying that they have HIPAA compliant health platforms. And so if that's the case, how is that going to change your primary care like visits? And um, they are encouraging doctors to participate in these referrals and co-management. So that is a plus, but it's going to change the entire landscape of healthcare. And I don't think people are ready for that. And then, of course, there's tons of data privacy things. And as a founder, though, from a tech company, it's fantastic because it's a way for us to survive. But at the same time, we're going to either fall in on vertical or horizontal, with these big players. The problem I have as a founder is how is that going to affect software licensing agreements? How is it going to affect, you know, our IP, right? If we're going to be like eaten up by all these big guys, or how are we going to partner if they have so many companies under them? Is it going to turn into like a Google situation? There's one search engine. So those are the kind of things that we think about as a founder. It's either you're on the infrastructure or you're a feature. But doctors, this is going to affect them, their payment ways. It's going to affect attorneys. So, and it's going to affect the patients ultimately. And so we just want to make sure that, I always say this, that the patients first and then profit second, but obviously that's not always the case in real life, but that's the, hopefully the goal, should be at least. So hopefully attorneys can, play a role in these policies. So outcomes are better and it can help a patient.
Another great segue. Thanks so much for that, Neil. I'm going to turn this over to you. Akiva, I think you were already talking about the CMS access provisions or the rules, guidelines that are coming out. So Neil, kind of combining that with the takeaway. So I kind of had two things that I wanted to end on, which is, we are seeing a lot of shifts. It sounds like there's a lot of regulatory shifts. And then, having as someone who has been engaged with the healthcare industry for well over a decade, there seems to be a remarkable sort of convergence of there's AI, there's regulatory shifts. So those both are kind of playing off of each other. Neil, what in your view, where is this all going? What are the effects? We've been talking about a lot of them, but what are you seeing in the next 12 to 24 months? And then there is a question in the comments too, that's also kind of asking something similar about upcoming Medicaid changes, workforce shortages, regulatory uncertainty. How is this affecting transactions? So lots in there. Feel free to kind of take what you want with that in that. And start us off with wrapping this up.
Yeah, absolutely. Easy question, right? It's always hard to say. And I'm very curious for Kaushik and Akifa's thoughts on this as well. But I do think the two biggest issues that I see right now as disruptors are AI and the kind of biomedical innovations, especially GLP-1s. I mean, I think that this has been an issue with utilization and cost, like increasing significantly over the last several years. But this is kind of a bomb, right? It is something that has a huge amount of clinical need, a huge amount of desire to access it. With questions as to whether or not you meet the standards for clinical need, which are different depending on payer. But it's expensive, and it's triggered kind of a gold rush to some degree, but also kind of a public health desire to kind of access these drugs. How do you cover them and get access to them without destroying, premiums on the insurance side, without destroying margins for systems or providers that want to furnish them to patients? I think that's going to be a big challenge. So that's one side. The other side is I do think AI is scrambling how the entire regulatory system works with respect to healthcare. And Akiva laid out a lot of interesting challenges. Just to lay out a few others, who's responsible, right? I mean, you've created an agentic AI. It's making decisions. It's communicating with patients. Is that the practice of medicine? What if they make a mistake? What if there's an issue? What if it's the patient's issue? But who teases that out? And how do you defend any of those things? How does it change how we set reimbursement right now? I mean, right now, the way we generally set how physicians, hospitals, et cetera, get paid is you look at how much it costs to deliver care over years in many cases. If you're suddenly shifting to agentic AI and you're changing who's making decisions and how much personnel it takes and how many supplies it takes and adding tokens in to part of the cost model, that really changes, how we've historically priced all of this. And so I do think we're entering a period of substantial uncertainty just around what the rules are, how people get paid, what their accountability is. all of those things. And so on the transaction point, uncertainty is never something you want to see from a transactional perspective, right? I mean, you want to be able to predict, I'm buying this thing, I understand its history, and therefore I can make some educated guesses about its likely success in the future. I do think it likely makes certain kinds of providers maybe a little less attractive. I also think, though, that anytime you have disruption, there are businesses out there that are helping people navigate that disruption and understand it and, bridge the gap. Because at the end of the day, one of the privileges of working in healthcare law is that it's always going to be needed, right? I mean, there are always patients, there are always people treating those patients. And what we do as lawyers is kind of bridge that gap and cover all of the many legal issues that pop up in that relationship. And whether that's being mediated through AI, GLP drugs, all sorts of business models, however that changes, there are rules around it. And when you're in that moment where those rules and the context is shifting, that is an opportunity. And I'm seeing a lot of kind of interesting business models growing right now around helping traditional providers kind of transition to whatever is coming in the future.
Hey, Kaushik and Akifa, Kaushik, maybe we'll start with you, and then Akifa, if you want to wrap this up fully. We have, and now before we do that, we have about 5 minutes left. But if those of you who are on can hang on for a couple minutes, we'll be done pretty soon at 6 p.m. Central.
Yeah, I'll just say in the interest of time, I know we got a couple questions in the Q&A. I'll just say I agree wholeheartedly with everything Neil was saying now, especially on the AI pieces. Akifa's right. There's an opportunity for lawyers now to set the policy because there is so much uncertainty in the space right now. The three things I hear over and over with AI from the more risk averse parties and larger hospitals are one, data security and privacy. Two, is it how much are we encroaching into the practice of medicine versus how much do people have to oversee it? And three, what's the actual financial value proposition? No one in healthcare, especially in the larger hospitals, buys technologies because they're the cool and exciting. It has to demonstrate a very clear return on investment financially and clinically. And so you're starting to see a lot of questions surrounding that, not only about AI, but especially because of all the focus on it right now, but just any new technology coming into healthcare. But I agree with Neil otherwise. I mean, the things to keep an eye on are the new and emerging devices and technologies that are coming out, artificial intelligence. And I would say the other thing is going to be reimbursement changes in reimbursement models. There's going to be a lot of focus on CMS in the next 5 to 10 years on that in terms of new bundle payment strategies or capitation models or other types of innovation models that they can do to try and cut costs in some way while still incentivizing good outcomes.
You got final words.
So these are the things that keep me up at night. Oh my goodness. On my side is literally the wild, wild west. So I could say to attorneys, buckle up because we got a lot of work that we can do in the next decade, I would say. I want to reiterate that I think it's really important that attorneys need to be on Capitol Hill. I think that they need to be a part of lobbying groups. I think that they absolutely need to be a part of, making all of these policies, whether it's in the hospitals, like the legal counsel in the hospitals, and the state level and on the federal level. I think that we have to be friendly with big tech and also their priorities in the private sector. I also think that, at the end of the day, they want to reduce costs, right? And if AI does, it is very useful, but obviously there are things like job displacements that you have to think about. And access is great in some regards, but CEOs of hospitals, their priorities is also to make sure that all their stats and everything is solid for hospitals to have good standings. And for them, it is profit based. And despite, you could argue it's not fee for service, but insurances are very much fee for service still. And in regards to value-based care, in with the bundles and things like that, it's a push in the right direction theoretically, but in practice, I mean, you have CEOs that are crafting the policies for that are actually not in the best interest of patients, unfortunately, and in the best interest of of profit, but wrapped around with a public value-based care policy behind it. So those are things that all have to be addressed by attorneys. And then on the larger scale, I will say two things. One, we have to think about infrastructure because all of this is going to have like energy, water. It takes like a lot to maintain it. So what happens? I genuinely think that there's national security risks in healthcare, like with all of this, with data privacy, with the AI race, between different countries and manipulating people's health or, all kinds of things. So I definitely think that there's also room for the infrastructure part that we have to think about to maintain all of these and what would happen if we have to go offline or collect our data or at the patients, how can they better understand the value of their data, right? And who they choose to give it to. And then the last comment I'll say, so yeah, infrastructure is really important, not just the actual industry. Like how is it going to be governed and infrastructure? And then the last thing I will say is that it's honestly really cool to be on the business side of it because people are making really awesome, innovative technologies. I mean, Neuralink, they're literally helping people with disabilities, through their brain computer interface technologies. So they have like little chips, and someone that's paraplegic will be able to say what they want via a computer. I mean, there's even legal issues within that. Imagine someone that has minimum cognition if they have informed consent in a court of law, is that an estate, is that valid? Are we going to take what the computer has to say? So there's so much stuff there, but it's really cool, and people really, really do care about the technology that they're building. A lot of them are passionate about it, and they have family that were sick with cancers, and they're making really awesome innovations and inventions. And I will say, AI is literally the new electricity. I keep telling people that. It's before, not even Google, pre and post Google, it's electricity, pre and post electricity. So we truly are in a renaissance, so to speak, in an AI race. And I do think it's going to be in every single, industry. And there's going to be children that are brought up that never knew that there was a time before. So with that being said, those are things that we have to also think about because it's health as well. If they're also related to if they're learning that AI is the go-to, imagine this, a child that doesn't know that they could memorize and their cognition is the one that inputs into the AI, right? They won't remember and recall as much, right? Whereas now we know that, okay, I just want it to assist me. But when it gets so good that you're not even thinking about it and you're the one that is just putting all this information in there just to get it, it's way quicker to just recall it. You're not going to remember stuff. So that gives a lot of power to the tech companies. And again, that comes with AI governance. I know I was going on a little bit of a rant, but it's a larger picture of what really is happening in the world. So I hope that attorneys can play their role in all of this.
We may need another panel on AI governance. We have one for those of you. There was one about AI will see you now, but it sounds like this is the as we wrap it up that there I'm hearing more discussions even outside of panels. There's more discussions on this. So all thank you so much for joining us. Neil, Akiva, and Kaushik, if you could put whatever you want to put in the messages. If somebody wants to reach you, that would be great. And we'll look for anything else. I see someone says your rant really resonated. I was smiling at the AI is the new electricity. I'm pretty sure a lot of people have been thinking about this. So thanks again. Thanks again, everyone who's joined. Thanks again, everyone who's been speaking, and look out for more from this section. There's more coming this year. All right. I will start to end the chat. Thanks all.
Thanks, everyone.